Do you need help with marketing, new clients, or online reviews? MassageBook is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's MassageBook with code ABMP50 for $50 off. Don't wait. Give it a shot today. Are you looking for a company that empowers your growth and development? Look no further than the Elements Massage brand, where all massage therapists have the opportunity to thrive through the Elements Massage Career Advancement Program. In the Elements Massage Career Advancement Program, Elements Massage Studios recognize, reward, and uplift their massage therapists, rewarding continuous learning, commitment, and growth. The Elements Massage Career Advancement Program includes professional, elite, and master levels, where massage therapists will enjoy higher commission rates, access to continuing education and development opportunities, and unique career growth opportunities to propel them toward a successful future. Evaluate your career and apply to an Elements Massage studio today. Visit elementsmassage.com/careers and take the first step towards a fulfilling journey. That's elementsmassage.com/careers.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Today's I Have a Client Who story comes from a massage therapist whose client has a particularly challenging condition. We have talked about hereditary hemochromatosis, or HH, before, but this situation brings in some different variables from our previous edition, especially around musculoskeletal issues, and of course, this is very relevant to our work. Before we dive into the story, here is just a brief recap about hereditary hemochromatosis. This is a genetic disorder. It affects about 1 million people in the United States, and it involves two main problems. A person absorbs too much iron from their food, and they don't shed enough iron in their urine and feces. While the term hereditary hemochromatosis sounds like inherited blood color disorder, it's not really about having super red blood. It was actually named for the deposits of iron that were found in the liver by a doctor who was among the first people to write things down about this disease. If this is interesting to you, I recommend that you listen to I Have a Client Who, episode 317, where I go a bit into the history around this issue. Now, here's a little bit of information about iron. We need it. We need iron to help carry oxygen. Remember, iron is at the center of our many, many millions of hemoglobin molecules. And we also need iron to make red blood cells. And we use it to make some hormones. If we have too little iron, then we lose oxygen carrying capacity in the blood, and this is a kind of anemia. And if we have too much iron, then we get deposits of it in the liver and elsewhere. Free radical activity damages cell membranes and causes inflammation and fibrosis. The liver becomes enlarged, cirrhosis is common, and liver damage that can eventually lead to liver failure. Hemochromatosis can do the same thing to the pancreas, so say hello to new onset type 1 diabetes. When it affects the joints, well, we'll get back to that shortly. Even the heart can be damaged by having too much iron. Think now about heart failure and atrial fibrillation. And to make things more complicated, let's add together super extra heavy iron-loaded blood, a weakened heart, and atrial fibrillations. And what we see is that the risk for stroke with people who have HH is much higher than it is for the rest of the population. Liver, pancreas, and heart damage is the short list of possible hereditary hemochromatosis-related problems. Too much iron can also affect the function of the spleen, the adrenal glands, the pituitary gland, the gallbladder, and the thyroid. It can cause erectile dysfunction in males and early menopause in females. Iron buildup throughout the body can even discolor the skin, creating a bronze-colored cast in light-skinned people. The typical treatment for hereditary hemochromatosis is to alter the diet to reduce iron intake and the intake of iron-retaining substances, and to regularly donate blood. This is called therapeutic phlebotomy. Fortunately, the donated blood of someone with HH is usable by others, so everyone wins with that scenario. Donating blood brings iron levels down to where organ damage is less likely. If this is not a sufficient intervention, or if it isn't possible to donate blood for some other reason, then there are some medications that can help as well. So to recap, hereditary hemochromatosis can be a dangerous disease with a lot of serious and even life-threatening complications. It is especially dangerous for people who don't menstruate because menstruation is another efficient way to lose both blood and iron. But there are some treatment options. They're not complicated, and they're generally really successful for people who live with HH. Okay, I hope you now feel a bit oriented because here goes our story, which I have edited just a bit. It goes, I have a client who struggles with hemochromatosis. It contributes to joint pain and arthritis, currently presenting in the major joints of the hips and feet. This client is staring down the possibility of a hip replacement and surgery on the toes to relieve their pain. They also have a history of multiple surgeries on their knees. I had worked with this person previously, but they told me that since that last time we worked together, they've had 2 strokes. The client told me that the strokes were due to a deformity, their words, not mine, to a blood vessel in their brain and not to blood clots. Since the strokes, this client has had and is prone to petit mal seizures. Okay, this is Ruth again. This language about a deformity in a blood vessel in the brain makes me wonder about arterial venous malformations. This suggests that their strokes might have been hemorrhagic strokes related to a burst blood vessel. I just learned for this episode that these strokes can be small and sometimes not even detected, and that was a big surprise to me. Also, we know that a small percentage of people who have strokes develop seizures later. That's a different topic altogether. Now let's go back to our contributor. They say, while I felt bad for the pain and discomfort this client struggles with, I was also excited because I rarely see clients where I work that share so much detail and honesty about their health history. I am assuming that this client does not menstruate. While where I work does not ask for pronouns, I'm also not in the habit of introducing myself with my pronouns or asking clients for theirs. This client is male and masculine presenting, but without explicitly knowing, I will continue to use gender-neutral language. Ruth again. So if this client is assigned male at birth, we know that they are vulnerable to the complications of HH without the advantage of a menstrual cycle that can mitigate some of those consequences. And our contributor continues, my question is, what considerations, if any, should I take when working with this client? I started with a more conservative approach, but they can comfortably handle the increased stress of deeper, slower, narrow work, especially around the glutes and hip joints. The stroke history was concerning, but this client also does physical therapy, so I felt safe easing into more complex work. Is there anything I'm missing? I thought about referring to a good colleague of mine who does great ashiatsu for the hips. Is there anything else I can do to relieve this client's joint pain while remaining safe, successful, and within my scope of practice? I eagerly await your response and hope this can be a more nuanced discussion about hemochromatosis, stroke, joint pain, and joint replacements. Well, thank you, contributor. That's a tall order, and while I appreciate your faith in me, you have given me much too much credit. But that has never stopped me before, so here we go to at least begin this kind of discussion. A 15-minute podcast isn't really the medium for a deep dive into the complexities of a situation like hemochromatosis plus stroke history. So I used this opportunity just to take a closer look at the overlap between having too much iron in the body and the risk of joint damage. And this scenario has a name. It's called hemochromatosis arthropathy. And now I get to share a new vocabulary word, hemosiderosis. This means pathologic condition of hemosiderin, which is not very helpful. What it actually refers to is these deposits of iron. That's what hemosiderin is. It's a deposit of iron that's wrapped in a medium of proteins and polysaccharides, and these accumulate in various places in the body. Hemosiderosis can occur in the lungs if there's been a lot of bleeding from repeated emboli. In the kidneys, we can see this as a complication of long-term dialysis. And in other tissues like skin, joints, pancreas, and liver, we attribute this to hemochromatosis. And as we've seen, this is an inflammatory process. It gets in the way of normal function. It sponsors the production of a ton of scar tissue, and it can cause pain. A high percentage of people with hereditary hemochromatosis develop joint pain, and for some, this is actually the symptom that leads to their initial diagnosis. It often begins in the knuckles, but it can affect the wrists, pubic symphysis, knees, and hips as well. One of the hallmarks of hemochromatosis arthropathy is a condition called pseudogout. This is an extreme flare of inflammation and pain at a joint that mimics gout, but that involves different chemicals, calcium pyrophosphate instead of uric acid, and therefore it needs different treatment to what we use for gout. Sometimes joint pain resolves after therapeutic phlebotomy for people who have this, but not always. The damage to the synovium and nearby structures can be permanent. So we know that calcium pyrophosphate deposits develop within and around certain joints of people who have hereditary hemochromatosis. These joints can degenerate with bone spurs, cartilage damage, open cysts under the cartilage, and dysfunctional synovia. This damage is sometimes not reversible, and many patients continue to have pain even after their HH is controlled, and so they become candidates for joint replacement surgery. I was interested to see if the joint pain that we see with HH is directly from deposits of iron inside the joint spaces, like we see it with organs like the liver and the pancreas. Some early studies suggested that this was the case, but later findings don't support it, so I'll go with probably not. However, I will say that people with HH are about 9 times more likely to need joint replacement surgery than other people. They have joint replacement surgery at a younger age, and they are much more likely to have multiple joint replacements than we see in the general population. Taking this back to our client, remember, here's what our contributor sent. Their hemochromatosis contributes to joint pain and arthritis currently in the major joints of the hips and the feet. This client is considering the possibility of a hip replacement and surgery on their toes to relieve joint pain. They also have a history of multiple surgeries on their knees. My question is, what considerations, if any, should I take when I work with this client? I started with a more conservative approach, but they can comfortably handle the increased stress of deeper, slower, narrow work, especially around the glutes and hip joints. The stroke history was also concerning, but this client does physical therapy, so I felt safe easing into more complex work. Is there anything I'm missing? I thought about referring to a good colleague of mine who does great ashiatsu work for the hips. Is there anything else I can do to relieve this client's joint pain while remaining safe, successful, and within my scope of practice? So it sounds to me like the real question here is, if this client wants help with hip pain, is it okay to continue doing this kind of deep, slow, narrow work around the glutes and hip joints? What about ashiatsu? And what else might ease their joint pain without causing harm and staying within their scope? Well, I'd like you to think about that for a moment. What would you do in a situation like this? And the truth is, everybody's answer is probably going to look a little different. I have to confess, I'm quite concerned about this stroke issue, and I encourage this massage therapist to follow up on that to see what kinds of things might increase the risk of a repeat episode with this deformed blood vessel inside the brain, and if the client can track what their seizure triggers might be. This isn't an episode on seizure disorder, so I don't want to go too far down that rabbit hole, except for to invite you to send me your I Have a Client Who stories. But I do want to say that this definitely needs to be on the radar for making clinical decisions and preparing to be safe with this client. That said, if the client is not looking for a full-body rock'em sock'em Swedish or sports massage, but is instead hoping for more focused work that might relieve their hip pain, I think we're on safer ground. It always goes back to what the client can easily tolerate in terms of homeostatic challenge, right? So my standard answer for questions like, when is too much, is to go slowly. Do shorter sessions, increase your intensity incrementally, monitor results to see what the client likes and dislikes, and what seems to move the needle in the direction of the client's goals. A conversation with their physical therapist might also be in order, just to make sure everyone is on the same page, especially with this information about their stroke history. I have to emphasize here, I am not the go-to person about how specifically to help the person with their hip pain. What I can say is that one of the consequences of joint replacement surgery at hips and knees and elsewhere is that there will be some permanent limitations on range of motion. So be aware of this for this client's knees, and if they end up having hip or foot surgery for the same problem. This was an interesting dive into what seems like an obscure condition, but I actually hear about hereditary hemochromatosis with some frequency. Remember, it affects about 1 million people in this country, and I bet it affects someone close to you, as it does for me. I hope this little exploration will help you to feel more confident about helping your clients with this complicated condition.
Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more.